Welcome to another Spotlight video where we walk you through a spotlight figure from your textbook. This video walks you through the regulation of female reproduction spotlight found in Chapter 19. After watching this video, you should be able to summarize the hormonal regulation of female reproduction. Have you ever wondered how oral contraceptives prevent pregnancy? For female reproduction to function properly, there must be a coordination of cyclic events governed by hormones of the hypothalamus, anterior pituitary, and ovaries. Notice the key at the bottom with red arrows indicating hormonal stimulation and blue lines representing inhibition. Let's start on the left with the ovarian cycle. The anterior lobe of the pituitary gland secretes FSH and LH to stimulate the ovary to secrete predominantly estrogens in the follicular phase, followed by progesterone during the luteal phase of the ovarian cycle. The figure on the right illustrates the same process, the ovarian cycle plus the uterine cycle, over a typical 28-day period. The first week is the menstrual phase of the uterine cycle, when blood and uterine endometrium from the previous month's cycle are discharged. In the proliferative phase of the uterine cycle, the functional layer of the endometrium regenerates. In the secretory phase, the endometrium thickens and releases more secretions while simultaneously receiving hormone signals from the corpus luteum. The interplay between the ovarian and uterine cycles is regulated by pituitary and ovarian hormones. In a typical 28-day cycle, the first day of the menstrual phase is day 1. At this time, gonadotropin-releasing hormone, or GnRH, from the hypothalamus stimulates the release of follicle-stimulating hormone, or FSH, from the anterior pituitary. As a result, an ovarian follicle develops and releases estrogens. These estrogens, especially estradiol, stimulate endometrial growth and secretion. As the ovarian follicle grows, it also secretes inhibin, a hormone that negatively feeds back to reduce FSH release from the anterior pituitary. At around day 14, the midpoint of the female reproductive cycle, estrogen levels peak, triggering a surge of luteinizing hormone, or LH. LH causes the primary oocyte to complete meiosis I and the follicle to rupture, an event called ovulation. LH also causes the ruptured follicular remnant to develop into a corpus luteum, which produces progesterone, the dominant ovarian hormone of the second half of the cycle. If pregnancy does not occur, the corpus luteum degenerates and ovarian hormones decline. The endometrium is no longer hormonally supported, so it sheds. GnRH secretion increases, and a new cycle begins. In summary, female reproduction is regulated by an interplay between multiple hormones. GnRH from the hypothalamus triggers the release of anterior pituitary hormones, FSH and LH, that cause the ovarian follicle to grow, rupture, and develop into a corpus luteum. Prior to ovulation, the ovarian follicle releases principally estrogens, and after ovulation, it secretes predominantly progesterone. These two hormones stimulate the uterine endometrium to develop. It's important to remember that pituitary hormones stimulate the ovarian cycle, causing a release in ovarian hormones, which in turn stimulate the endometrium in the uterine cycle. So what? Why is it important to understand the hormonal regulation of female reproduction? Well, this knowledge helps us understand oral contraceptives, also known as the pill, one of the world's most prescribed medicines. Most oral contraceptives contain a mix of estrogens and progesterone. The hormones in the pill negatively feed back to the hypothalamus and suppress GnRH release, resulting in no FSH or LH release, no ovarian follicle development, and therefore no ovulation. Without ovulation, pregnancy cannot occur. If the pill is taken correctly, every day, it is over 99.7% effective. However, like all medications, oral contraceptives are not without risks. In rare cases, hypertension, blood clots, and stroke are possible. This is especially true for older women and women who smoke.